This is Healthcare That Clicks, where healthcare, innovation, and big ideas collide. No fluff, just the strategies reshaping the future of care. Here are your hosts, Ryan Kelly and Will Moon.
Hello, everyone. My name is Ryan Kelly. With me is our co-host, Will Moon. We are both entrepreneurs in Mississippi working in the digital healthcare space, and it is our pleasure to bring to you episode 1 of the new podcast, Healthcare That Clicks. Today's episode is Listening, Learning, and Logging, How Ambient AI is Changing Clinical Documentation. Will, pleasure to have you on. Looking forward to the conversation today.
Yeah, man, it's going to be a fun one. This is a hot topic right now for sure.
Absolutely. I know, you and I both have been playing around in AI quite a bit here lately. And I tell you what, every day I think ChatGPT adds more value to my company and what we're doing. I've been using it literally all morning, writing descriptions for conference sessions and coming up with a few graphics. And just the power that AI has right now is really, it's incredible.
It's done a lot to take people from, a 2x level on productivity to a 10x level. Just like you're saying, we've essentially seen a lot of the LLMs like ChatGPT, and Anthropic has a really good one called Claude. They function essentially as our company COO in a way. A lot of our operations and policies and decision making and everything run through some sort of program at this point, to get feedback and direction, insights. So, it's getting hard to see a future where we operate apart from the AI tools.
Yeah, Pandora's box has been opened, and it's here. The question is going to be, it's not magic, it's programming, and it's learned programming. So it takes the programmed information, it can build upon itself, and it takes content that humans have, whether integrated into the software or searchable on the web, and is able to come up with, based on algorithmic probability, how likely of an answer it is that we're programming in. And it's truly fascinating, and it's only going to get better. But like you said, I think the genie's out of the bottle now, and we're using it. It's going to become more and more of a staple of what we do. Already, you Google something and it gives you the AI summary at the top. Most people don't even realize that is AI working for them automatically. Even those that are opposed to AI are already using it. They just didn't realize it.
That's right. And it's kind of funny that the LLM tools have made it so popular. And it's kind of like Google did with its search functionality. It took tools that were already there and created an interface that made it really easy to use, and a lot simpler. But AI tools have been around forever. That's what auto suggest is. That's what autocorrect is within Microsoft.
That's right.
And so, it's interesting to be talking about the ambient AI space, because even our company has started to use ambient AI in a way. We use a product for calling patients with our nurses where we can transcribe phone calls and get feedback and create set notes. And the benefit for us is that it does integrate directly with our system. And I'm sure we'll get into it, but that is going to be another barrier for a little while for a lot of these ambient AI groups and businesses, is that they don't currently integrate with EHRs. And so a lot of the physicians, there are some hype, but a lot of the physicians and providers using these tools are still having to, 2 tabs open, I record and here's my note and I copy and paste and make sure it's formatted correctly. And so there's still a good bit of clicking around and so-called clunkiness to it, but it's getting better.
It is getting better. And the good thing about the AI is it's able to, through, patching code, is able to get in and do some of the things that previously with add-ons to an electronic medical record were extra difficult for providers, because now you're logging into multiple pieces of software, updating all of them simultaneous, questionable whether they actually talk to each other. The AI actually helps in that case and is able to fill in a lot of those gaps in a quicker time frame. So, but you're right though. The fact that not all of them are built into the EMR or whatever software you're using, it definitely adds some clunkiness to it. It's a barrier right now. It's probably a barrier to entry for some because they would see it as just one more thing to do. But I agree completely. The ambient AI is very exciting, and it's something that I think is really going to make a difference and is already making a difference in healthcare right now. A lot of our facilities are using it. You said y'all are using it with Link Healthcare. There's so many use cases for ambient AI, let alone just the other AI products. It's pretty exciting.
Yeah, and some of them are very sophisticated. We were talking before we started recording, and I think at the last tally I saw, there were around 126 startups in the space between communication platforms and dictation platforms and just listening devices that'll transcribe and supposed to do magic things with your audio transcription. One of the companies that kind of stands out to me right now is a company called Ambient. And I don't know, I'm sure you've heard of them. They're one of the bigger ones in the space. And they were selected by Cleveland Clinic to be used as their ambient AI tool because Ambient has something within within its memory or within its learning capability where it can distinguish, and it does different magical things for different specialties. It's not like a lot of these other ones, and one of the reasons that there are so many is that a lot of these ambient AI tools are trying to do what a lot of other digital tools do, and they're trying to niche down, and they're trying to go just GI or just endocrinology or just the hospital side, or so they want to be the AI scribe for this specialty or this specialty. And so I think that's where it'll be interesting to see kind of how that market plays out, because that market just in the last 2 years went from zero to over $1 billion.
And it's going too.
Yeah, I mean, its calculated annual growth rate right now is like over 15 or 20%. It's unreal. And so it'll just be interesting to see like market consolidation, what companies come together, what tools end up winning the day. Is it going to be the tools that focus on the specialty? Is it going to be the tools that like Ambience that can kind of, do it all? So what do you think?
Well, and we saw the same thing with electronic health records. I mean, we had how many companies back in the early 2000s, mid 2000s, late 2000s, hundreds of them. And then they all, some close, many of them are purchased and consolidated. And now you have, a couple of handfuls of companies that exist globally. And you'll see a few people try to inch into the space. But the problem is there's not really a reason to get into the space any longer. Unless you can bring a value add that doesn't exist, then you're just a competitor, a loss leader competitor trying to get in and hope that someone buys you for some use case. And so right now, I think we're back in the early to late 2000s on electronic health records, but when it comes to AI. And so I agree completely. You're going to see consolidation of these companies. You're going to have, language models that'll be merged into other language models. The interesting thing there is going to be how much can these companies learn from one another, and then you don't need to buy them anymore. So can the big ones learn from the small ones and then completely devalue their market share entirely because now their code has been taken? That's a whole other thing that I don't know how that's going to go, but it's going to make this a really interesting competitive market over the next decade or so. And I agree, though. I think you'll have your big ones that survive and thrive, maybe a couple of other ones we don't know about that maybe don't exist yet that'll pop up. But I don't think you'll continue to see your niche AI products stand alone. I think they'll probably be purchased and integrated into some of the larger ones. That's my guess anyway.
Yeah, and you're probably not far off. I mean, it's almost like anything else. It starts off fragmented and consolidates, and then sometimes it fragments again. Like we see that with streaming services, right?
Exactly.
It's we went from TV channels to streaming, and now we're back to all of these different TV channels that have their own streaming service.
Yeah, exactly.
And so I was laughing whenever you talked about the EMR space and how there used to be so many different EMRs or EHRs in the market, and now there's not. There's probably 10 to 20 key players, and Epic sits at the top with like 65% market share. And it's kind of interesting because there is a playbook there, and that's another thing that we're seeing kind of play out. And it would be really interesting to get your take on this for for the ambient AI space as one, but then just kind of for AI in general. But one of the things that led to a lot of that EMR market consolidation was the CEO of Epic being appointed in the early 2000s to a health committee and getting kind of a sweetheart deal where physicians and providers, a decade or two ago, were paid to implement an EHR.
Mm-hmm. That's right.
And so she gets this, she gets this thing worked through Congress to where, essentially the government pays to implement her software solution for all these physician practices. And it's so big and it's so complicated and requires so much specification for each provider that they work with that once you're embedded, you can't unembed. You can't just detach from
It's like
using
a
Epic.
marriage. Yeah.
Yeah, whether you want it or not, you're now stuck with Epic. And so it's been interesting to see her company grow in market share. If you go back 30 years ago, they were doing like 75 to 100 million in revenue, and I think today, on average, they do 4 to 5 billion a year in revenue.
Incredible.
Yeah.
Not to chase the rabbit too far, but I mean, take that a step further. Look at all of the hospital and clinical mergers that you've seen or the acquisitions that have taken place, not because of, a market driven aspect, but because of the EMR. We've seen a lot of them down in the Southeast where you and I both live, entire hospital systems that gobble up other hospitals because that hospital wants Epic or they want Cerner or they want whatever EMR is there. And I think we're going to see the same thing with AI as it becomes integrated into the electronic systems of these hospitals and is able to capture the data, the conversations between providers and patients. I think especially as you start getting into some of the ambient wearables and technology that can go into a clinical room. You already see that now. There's devices that can take heart rate, blood pressure, temperature, biomechanical things that are on the tables that can weigh the patient. So none of these things have to be done when a patient comes in. They're all integrated into the hospital. All that ties directly into that ambient AI that's capturing the notes for the provider. They're entering it into the EMR. All of this is just adding fuel to the fire of the acquisitions and the need for bundled technology. And you see far fewer standalone facilities as a result. And I think this is why. It's a lot of technology, it's a lot of opportunity, and it's really hard to do that on your own.
That's a hot take. That's an interesting comparison. So what are your thoughts on the government's role in some of this potential future consolidation? Because I know that was a big thing with Epic. One of the things that the government did along with giving those providers money was essentially they were like, hey, we're going to give you money, you got to implement an EHR, but it has to meet these standards, and guess who met those standards and helped set those standards?
And help set the standards,
and so,
right.
Yeah, and so it'll be interesting, in this space. I know we've already seen Sam Altman, the CEO for OpenAI, testify before Congress a good bit, and he's a very vocal and kind of controversial figure in the space who claims to, push for government oversight. But as a lot of, outspoken people in Silicon Valley have been talking about over the years, government oversight is usually pushed by the first biggest potential winner in a new market. And so it is interesting. It's kind of like Mark Zuckerberg, with Facebook. It's, like one of the largest social media platforms in the world. It's like him going to Congress, like, yeah, we definitely need more oversight. Like, okay, I'm sure you do.
Exactly. Yeah. Now let's have as much oversight as possible to keep anyone else from competing against us in the market.
Exactly.
Well, and so, for the sake of our listeners, this will give a little insight into some of maybe our political leanings. You and I both kind of fall into the free market capitalist. I would venture to say it elements libertarian side. Not always. I would call myself libertarian and capitalist in a lot of ways. And in some, I do believe in government oversight and accountability and guidance. I think there's a role to play there. But Senator Cassidy, a couple of years ago, I heard him. I was actually in D.C. when he was testifying on the Senate floor and saying essentially, of course, he's a healthcare background himself, and saying that healthcare in the United States is one of the least innovative industries in the world. And the reason is because it is the most heavily regulated industry in the world. And so I'm definitely not saying we need the Wild West cowboy mentality when it comes to healthcare, because that could be dangerous to patients and it could, risk, especially from the sake of HIPAA. Health information is very widely sold in the black market. We don't need to loosen those regulations necessarily, but at the same time, we've got to get entrepreneurs out there and allow it to push us forward. I think that's why AI has done so well, because it has been for the most part beyond government control and guidance. And I think the more we can keep regulations at bay, not to say that we want the Wild West again, we need HIPAA in all of what we're doing. If you and I were a doctor-patient relationship and we're sharing information, the last thing we need is any of that to get out onto the open market for so many reasons, not just for it to be sold, but also to be used against you in, a court, for an insurance company that might deny you coverage or whatever it might be. We need safeguards in place, but we also need innovation, and we need people to think outside the box and be able to do so.
I agree. And I know you follow it just like I do, but if you look at the trend, probably the last 10-year trend with digital healthcare funding from VCs, that's one of the easy ones to track, just to kind of see, where the finance guys are putting money into the healthcare market. And so when you look at VC funding for digital health companies over the last 10 years, what you see is, kind of a slow build leading up to COVID. And then you see rampant investment. And there was so much investment around the time of COVID in digital health solutions, because obviously everything was shut down. And we saw that, healthcare companies can still operate if they can operate remotely, right? Or virtually. So, you've got all these synchronous and asynchronous solutions that are coming out, all this VC backing behind it. You've got all this hype around it. And I think a lot of the companies that we saw during that time, had a hard time living up to the hype. I think, I don't know that it was necessarily all bad actors, but there were definitely some bad actors, specifically around the mental health space, and there was a lot of prescriptions with antidepressants and ADHD medications and other things that got out of hand. And so, the powers that be in government came down pretty hard on a couple of companies. And I think a lot of the other companies in the space, when we talk about like overhype, I always like to think of Teladoc as an example. We're telehealth guys. We've been telehealth guys for a while. Teladoc's a great example of a company that, shot up to, I want to say at the peak of COVID, their market cap was around like $63 billion or something. Mm-hmm. And I want to say today they're sitting at like, between a $1 and $2 billion valuation.
Let's see. I'm searching it up now. I'm actually really curious.
So, it's a significant drop.
Yeah.
But I think even that trend line that you see where it hypes up and then like it's a pretty steep drop. You kind of saw across the market.
I even realized. Oh.
Yeah, their stock ticker symbol just kind of lives on my home screen. So I track it. But I think that just that stock alone is pretty indicative of the market. And that's where we saw, a sharp drop in VC funding for digital health companies and startups in 2023. In 2022, 2023, we started seeing a little bit of a resurgence. 2024, it started going back up. And then with a lot of the AI tools, I want to say 2025 digital health funding is kind of back on the rise. Mm-hmm. But when I say on the rise, like peak years for digital health funding, there were $60 to $100 billion put into new companies in the market. And it got down to, I want to say 2 years ago, it was like maybe like 5 or 6 billion totally invested. And you and I encounter this all the time. There are plenty of problems within the healthcare industry to solve where we need solutions and entrepreneurs going after them, like you talked about. And it's gotten so regulated. And I think there's been a lot of bad actors that have taken advantage of certain things. Even just think about compounding pharmacy as an example. Like compounding pharmacy, when it first came out, great alternative. And then a bunch of people started, putting foot creams and a bandage and a Ziploc bag together or something, calling it a kit, and increasing the price by 1,000. Yeah.
Exactly. And especially when you can pawn it off on VA and Medicare patients, and have the government pay for 10 years, something that and that's the thing, it's the smell test. And the teledoc I don't put in this category by any means, but it's the smell test. Does something seem right? Or do you think someone is conning the system?
Mm-hmm.
And telehealth. You and I, again, we love telehealth. Coming back to Teladoc here for a second, their stock price right now is about $8 as of today, which is July the 18th, 2025. Going back, their peak was February the 12th, 2021, at $293.66. So that is quite a drop off. I can't tell the market cap difference between those two. They're at 1.4 billion right now in market cap. It's a big drop off for that particular company. I haven't looked at the others in here. I might kind of search American Well real quick because I'm a little curious.
I think American Well is delisted.
Well, yeah, it looks like they are. Wow, interesting.
I think they got delisted about a year and a half ago.
How about that? Goodness. So
Their
yeah,
stock,
it goes to show the
just for
evolution.
perspective, the American Well at its peak, it was never a huge stock, but it got up to like high teens. It was like a $16 to $18 stock. And when it got delisted, I want to say it was in the 60 cents, like around 60 something cents a share.
But you see hype, and hype happens at certain times. And so, like with COVID, and you and I are both very involved in telehealth at that time, you see the giant ramp up of investment. Now, the good thing is there was a ramp up of usage, and that usage in a lot of cases is still up, which is good. Yeah. That's what we want. Yeah. That's the whole reason you and I are involved in this, is to get the use case of telehealth up, and it's there, and it's integrated into a modality of care now, which is great. That's what we want. But you did see this enormous amount of hype behind the companies delivering the technology, kind of like your the .com bubble of the 90s, and you get a housing bubble in the early 2000s, a massive amount of hype into certain industries, and it balloons up and then ultimately kind of pops. Or what I might even say is migrates to the next industry, which right now is probably AI. It's probably a bit of a balloon, albeit it is a legit balloon. It has legit power, and it will probably change the course of innovation and industry throughout the next 50 years plus. But do all these companies need billions of dollars thrown into them just for them to be gobbled up by someone else? Probably not.
Yeah,
not to mention the fact
probably
these machines can kind of learn from themselves now. So you create something that, I'm not saying that Dragon from Microsoft is just going to learn from some startup and then steal it. I certainly would not say that, but it probably could. And so when you build something and you don't have safeguards on it, you literally could lose all of the investment, just because the power of these other machines to learn from your machine might be able to defeat its entire value. Or maybe not. I don't know.
Yeah.
But it's a possibility.
Well, I mean, it's kind of like that AI Chinese LLM model that came out several months ago, that like its whole logic was based on looking at ChatGPT's answers, and then coming up with a predictive tool to figure out what ChatGPT was going to respond with.
Yeah.
And that was so, like we're talking about, like models are being built on top of other models, and it's hard to see like where they synergize and where they butt heads, and kind of how that looks going forward in the market. There are, going back to the ambient AI specifically, there are a couple of interesting things about it. One, at least based on my brief research and some of the other blogs and people that I've read who've done a lot more research on this, it doesn't seem like there's actually an ambient AI company that truly integrates with an EHR, where you use the tool and it transcribes the conversation, creates the suck note, or whatever other information you need, and then does magic in the EHR itself. It seems like it's still primarily a, like we mentioned earlier, multiple windows, copy and paste kind of model. And so that is one interesting thing. There's some deceptive marketing around that, and integration. Another interesting thing is that the FDA has not yet, and that is one reason why there's so many entrants. The FDA hasn't done anything with this yet, hasn't addressed the tools or the listening devices. which kind of leads me to like my third kind of, question mark or red flag, which is the fact that, for tools like this, I think one thing in the healthcare space that doesn't get talked about enough is that the engineers behind the tools are not liable, but the doctors that use them are.
Yes, absolutely. And that's a scary thing. When you are putting your faith in a company, thinking that they are doing what's best in that industry, that they have your best interest in mind. Just like a patient places their trust in a doctor, that they're going to use their education and their knowledge to provide the best diagnosis for you. So too are those doctors placing their trust in the technology companies. And in some select cases, they're being lied to. And now they are liable for potentially millions of dollars of fines, fees, and possibly even worse as a result of it. So not to add a scare tactic to this at all, but it is something that everyone should be cognizant of who are you dealing with? What is the technology behind what they're selling you? And is this legitimate or is this a pipe dream? And then, has it been tested, proven? Those are all the legitimate questions.
Yeah, I think you're spot on with making the point to say it's not a scare tactic, because we don't want to scare people away from using the tools. Obviously, they're super beneficial and they're only going to get better. And at some point, they're going to integrate and they'll continue to do magic. I think your thought behind that is really, at the end of the day, the tools are a tool. They're not perfect. You still need to verify, double check. Don't be that viral story in the early days when ChatGPT came out and there was an attorney that created his whole like argument using ChatGPT and got it to reference these cases
Made him all
that
up.
turned out the cases didn't exist, and he gets in front of the judge and the judge is like, what is this? Like, these aren't real cases.
Yeah. Buckets versus Smith 2023 is like, there's no such case.
Yeah. So
boy, I wish I could lie for a living and get away with it. That'd be nice. Yeah, that was funny. But I guarantee you that's happened more than once. I'll guarantee you I've probably sourced something using ChatGPT and went ahead with it and something was wrong in it. I mean, it's inevitable when you do this. And of course they're all getting better. All of these, Grok over on X, Gemini, they're all getting better. But you do, you kind of mentioned earlier about the AIs that are learning from other AIs, and you end up with this little bit of an echo chamber at times that if they're learning from one another, if one error is in the system, that error becomes echoed and magnified throughout other search engines and other AI platforms. And then they're learning off of the error becomes reality. And now you're having to correct what people now see as reality. And that's what gets into the doomsday predictions of AI, is that even if not nefarious, but especially if nefarious, someone implants code or data in that is learned by the other AIs and they treat something false as true. And now everyone starts believing the thing that was false as now being true. How do you course correct that? Especially if and when everyone's leaning on AI versus their own intelligence. And that's, not to doomsday us here in this conversation, but that's where a lot of people go. And that's why so many people reject AI entirely, because they're worried about that, which is a possible reality. But knowing how to overcome it is, I think, the key to making sure it doesn't happen. Like knowing the plot of the Terminator and making sure we don't do that.
Yeah, I agree. And it's a fair question that people have. I don't have some magic rebuttal against it. I do think that some level of conscientiousness towards, potential issues and backdoor nefarious actors is something that should be on our radar. But just like anything else, I mean, we think about the same things with other complex systems that we use all the time, ensuring that, the tool is there to be used as it's meant to be used and not the way that, like you were saying, some other person wants to use it, some black hat operator. But the correlation, between like the kind of the resistance there, I always go back to telehealth. Again, since we're telehealth guys, you think about telehealth in the early days, and it was kind of a fringe tool. Honestly, it was hard to get people to adopt it. Doctors didn't want to mess with it. They like we all know, they didn't want to have an extra thing to do. They didn't want to learn a new system. They thought it would be impersonal to interact with patients that way. And a lot of the doctors were just pretty stuck in, hey, it can't be as good as me face to face with the person. And so I would say COVID was the big change in that adoption. Like you mentioned earlier, when we were talking, adoption has really stayed, that has had some staying power since COVID, because COVID was the thing that pushed a lot of people into using the tool. And after using the tool and seeing like, because healthcare, I mean, telehealth is always pitched as this huge disruptor. I think that's an important point to make in the healthcare space is you don't win in the healthcare space by disrupting. Nobody wins. Go look at all of the venture-backed startups that marketed themselves as a disruptor. They all went from billion-dollar unicorns to today they're like $200 million companies. Because you can't survive, and they don't market themselves as disruptors anymore. They solve unique problems within the healthcare space. And so the way to improve healthcare is to get into the system and figure out how to change it from within. You can't just come from the outside and drop a bomb and expect it to magically, be different thereafter.
Right. Because you're usually the one holding the bomb in the process.
Exactly. So I say that to say I kind of wonder, there is a lot of hesitancy. There's a lot of good questions around AI and its potential misuse. And the telehealth correlation was like a lot of the same questions were there too, because it wasn't just the impersonal nature or the fact that doctors didn't want something extra to do. It was also the fact that doctors were afraid, hey, I'm creating a liability channel. Like, if I have this telehealth visit that's going on, well, what if someone hacks it? Well, what if the videos are recorded? Well, where do they stay? And all of these other concerns and whatnot.
The same that we're talking about with AI, same concerns.
Exactly, which is why it's a great correlation.
That's right.
And so, what did the telehealth industry do? The government responded and they put out more guidance and recommendations regarding HIPAA. Insurance companies have started really, really digging into, especially for companies like ours that operate in the telehealth space, they really dig into when you're trying to get a cyber liability, you almost go through a HIPAA audit every year just to get that cyber liability now. And so I would say the industry has responded, and it could just be that, the AI industry is catching up to some of that, or will catch up. Or hopefully not, but it could be that there's another mass event that causes adoption.
Yeah, let's hope it's not a global pandemic.
Yeah. Amen.
Yeah. I want to get into some of the use cases of ambient AI, but first, just kind of the thought behind why. Why are we wanting to use this? It's not just another gadget or gizmo. One of the biggest complaints we hear in the healthcare system among physicians, nurses, just about anybody is they don't have enough time to do what they need to do. And, for me, if there wasn't any reason other than getting time back in their day, ambient AI will do that. Being that virtual scribe, if you will, taking those SOAP notes, completing the electronic medical record, assuming you have that integration, and they should, completing those tabs. You hear the click rate that doctors talk about with EMRs. I don't like this EMR because I have to go to 4 more screens and click. Well, these things will do that for them, and it'll produce the recommended billing codes that are then transcribed into the HIM office that the physician would sign off on. All of these things are things that they'd have to do over a weekend or a couple hours after the day ends, doing all their clinic notes. Now, not only can the doctor look at the patient versus looking at a computer and talk to them one-on-one, having a conversation versus having to type, but it's also documenting where that doctor would have to do that after the patient encounter ends, after the end of the day, over a weekend, 3 weeks later, which was a horrible process, but I know doctors who do that. Like, I can't remember what I ate for lunch yesterday, let alone conversation that I had and what someone's medical diagnosis was and my recommended treatment plan for them. And so to do that for 12 patients a day over a multi-day period, there's no way they're going to get that accurate. But with an ambient AI, it can take those notes, it can fill out the EMR. The doctor maybe a few days later might approve the chart for it to go to HIM to be filed for insurance, but at least then they've got the correct documented notes. They can edit as needed, but it's saving them just hours and hours of their time a day, let alone a week. And think how much money that saves both that doctor and that facility in their time, because now they're maximizing what they were taught and trained to do, which is treating patients, not filling out a piece of software.
Yeah. I mean, that's one thing that we see especially in the healthcare space, I feel like the doctors get a bad rap because patients are like, the doctor doesn't spend enough time with me in the room or whatever. And, I think it's because we failed to think about the causality there. And for a doctor, and most doctors, 80% of doctors now are employed by a health system. And for a doctor to be a good doctor to that health system, they're, up to date on their documentation and they have mentioned everything so that they get full billing and revenue cycle reimbursement there. And it prevents them from actually spending time with patients. And so there are still a lot of doctors out there that practice independently. And that's where, I'll give one example. One of the doctors that we work with, we're trying to figure out a solution for him right now because of this. But, I think the larger problem is that physician burnout is a real thing. And especially since COVID, COVID just seems to be a big marker for change within healthcare and its trajectory going forward. But since COVID, you've had a lot of physicians leave healthcare and go and pursue other careers in healthcare adjacent spaces, right? And so for the ones that remain, most are being employed now, which means they're beholden to documentation, limited time with patients. For the few that remain in independent practice, like the physician I was mentioning, he will spend 30 minutes with the patient in the room and, he'll take notes, but then it's not until he's done with patients at the end of the day and he goes home and he has dinner and then spends the next 3, 4, 5 hours documenting on the patients from the day. One of the big things for, just to give the example of like the guy in the independent practice, if you do that, well, then you're at the end of your day, you've seen a bunch of patients, you're tired, you still have a family that you've got to have responsibility, with, and you're not going to remember everything. And your entire practice depends on you being able to completely maximize your note for reimbursement. Like one thing that's a great example that a lot of physicians leave off, and a lot of the ambient AI tools use this as an example, is they help catch those things that happen within the conversation between the physician and the patient that if the physician would have just documented for, they could have built for. And smoking cessation is a great example of that, where, it doesn't take but a brief conversation in the room to get additional billing on top of that E&M visit. Mm-hmm. And that's where these tools really do a good job, or could do a good job of picking up some of that. But also that's where they get criticized too on the hype cycle. Because they're like, are they really just overhyped revenue cycle tools to make sure that the physician's billing is maximized?
Well, and that's an element of it. I mean, how many facilities are undercoding right now? They're not documenting everything that they need to be documenting in that encounter. And so they're leaving money on the table, and the insurance company's just sitting here saying, thank you. We're happy to not have to pay all these things that are actually owed to the doctor because they're undercoding. So I think it is going to do that. Another thing that I think is kind of interesting too is there's all these sensors. My wife is a teacher, and in the school setting, they have vape sensors that are in the restrooms right now because vaping is such a big issue in the public schools. And the same thing is coming back to those sensors.
Like it senses the smoke?
It does. It sends
that's crazy.
Chemicals from the vape, crazy. And then it alerts the office. So coming back to this, though, coming back to all the pieces of technology that can go into a clinical room, like taking blood pressure and heart rate and temperature from a patient, so too could it sense tobacco or the chemicals from vaping, trigger either the provider to ask the question about smoking or vaping cessation, or to simply be able to document, hey, this smell is here. We know what this is. This is obviously a treatment protocol this patient needs to undergo, because unless you're just around a smoker all day long, there's a certain smell that a smoker has. And I think we all know what that's like. The same thing could actually be said about alcohol or others as well. So as sensors are getting better, there's the invasive side where this could be out in the public, but in this case, it's part of the documentation protocol, just like doing blood work or anything else. You're going in, that doctor's able to then help you based on other cues that they're getting based on sensors in the room. Another cool usage here that AI would be able to pick up on that the doctor may not.
It sounds like a business you should start, Ryan.
I'm going to venture to say someone's probably working on it now.
Yeah.
Well, I want to go through a couple of these use cases here for our audience in case they're just really still stuck on a limb thinking, what in the world could you actually use this for in a practical way? So got 5 for the outpatient, 5 for the inpatient. Like you said, there's really hundreds of possible uses for this, but those that we've talked about already and that are probably the most common, the automated clinical documentation. We talked about that pretty extensively. There's the charting, reducing burnout, real-time progress notes, patient intake and triage. That's an interesting one we haven't really talked about much, but patients being able to come in and automated systems being able to put them into where they need to go in and even before they reach a hospital or a clinical setting. Virtual medical transcribing, that's again, we've pretty well touched on that. Clinical decision support, that's an interesting one in being able to help providers, physicians, nurses in the room come up with other possible diagnoses for what the patient is saying. So, they have their medical knowledge. They're going to come up with the ones that are most likely, but also a decision tree saying, hey, maybe there's some other options here that might be a little more in depth, maybe even more serious. We need to come and take a look at other than your basic cold, flu, sinus infection, that sort of thing.
Right.
Chronic care management, that's your world. Using ambient AI to look at patient speech, tone, behavior, suggesting worse chronic symptoms, looking at COPD, diabetes, those sorts of things. And again, you mentioned off on the beginning of the call that you're using that now. Inpatient setting, this is the one that's really kind of cool. Fall detection and prevention. I know hospitals right now that are using that, alerting nursing stations if a patient who's a fall risk gets out of bed, and even if they're stumbling some, noticing the gait and the trends and
Yep.
having someone go in early before they fall. That's awesome.
Yeah. Yeah, that one's
Kind of
huge.
similar, nurse call optimization, patient monitoring and behavior insights. Again, looking at the patient, looking at vocal patterns, restlessness during the night, sleep disruption, seeing things that the provider may not see as it's watching the patient during the day, which I know can sound creepy, but there's cameras in the room anyway. So
Yeah.
this thing is just trying to watch you, and AI doesn't care. It's not a person, it's a machine, and it's just trying to detect, vibrations or rhythms or patterns that look off and alerting people who can come and help you. Real-time rounding support. So physicians and nurses that are rounding, trying to get them into the most efficient place possible. That I've actually know hospitals are using that now as they're short-staffed, and it's a way to kind of overcome or compensate for the lack of a workforce availability. And then infection control, trying to make sure that compliance is taking place, janitorial staff, making sure they're cleaning everything appropriately and being able to watch them to see if there's something that didn't get wiped down, something that didn't get cleaned. So cool elements of AI usage in both the outpatient and the inpatient realms. And this is just kind of scratching the surface of what is really actually there. Well, we've covered a pretty good bit of ground here when it comes to the ambient AI and the use case for AI. Anything else you want to add for today's podcast?
Don't shy away from the tools. Kind of like we were talking about earlier with telehealth. Uh, the companies that label themselves as disruptors maybe don't go for those, but just like telehealth, we have all seen has been a valuable tool within healthcare and healthcare delivery. I think what we'll find in the future is that looking for the different AI tools and using them as such as a tool is what's going to make the real difference there and what's really going to win the day within healthcare AI.
I agree completely. Don't shy away, embrace it, use it in whatever way makes the best sense for you. Not every tool is going to be the right fit for everyone. Not every use case is going to be the right fit for every provider or every facility, but don't shy away. Let's embrace it. Let's go into it. Like we've said with telehealth, like we said with electronic medical records and every other example we said today, those who are using it early are the ones that end up winning the fastest. Those that are the lag leaders that wait until the last minute are the ones that are going to have the most trouble and will be the most behind. So let's go ahead and jump into this. It's a great tool. It's going to save time, effort, money, all of the things that we want to be doing. And it's going to really boost all of our providers, all of our facilities, and hopefully all of our listeners here on this podcast.
That's right. That's right. Good thought, Ryan.
Well, Will, thanks for being on. Good to visit. For everyone listening, we'll have more to come soon.
All right. Until next time, cheers.